What happens if your induction doesn't work? Is that even an option for most people? Does it ever happen? Today, I'm going to tell you what we do if your induction doesn't work and the things we think about as we're making the choices moving forward. Now, there have been so many people who think their induction is not working when really that is working how it was meant to work. It's so important that you understand what you're facing when you're going in for an induction. And I got to tell you, a lot of doctors really don't tell you the real truth in the office, which is why I created an induction checklist that you should go over with your provider before you go in for your induction. I'm going to link to it down below. Now, why would an induction not work? The first one is that your body just doesn't respond to the medications. These are proven methods to put you into labor, but they don't always work on every single person. So it is possible that your body is going to be like, no, this baby's too early. We are just not going to open our cervix up. Honestly, this is pretty rare. We can increase our number of medications and we can continue to give you doses of medications to see, if one of them will work versus the other one. It's pretty rare, but it does happen. When it does happen, this is the second reason is I think your body really thinks this is not time to go into labor, right? A lot of times we're putting people into labor at 37, maybe even earlier weeks of pregnancy, and your body is designed, when done right, to try and keep that baby in at that point in time, not expel it. So your body sometimes will fight the induction medications, which in a normal delivery would be great, but not always great if it's you. And then finally, your baby may just be in a position that's kind of wonky, like their head's going into the side of your pelvis instead of down into the birth canal. Now, some of that can be helped by using spinning babies and making sure that you're positioning. I think it's so important to use movement during labor. So, I hope nurses are getting better at doing this, but you as a patient should be asking your nurse, what kind of positions can I do? And your partner should be an active, engaged participant in labor to help you get in those positions to hopefully let the baby's head descend and push on that cervix and hopefully open it up and descend into the birth canal. And I got to tell you, a lot of that's not going to come naturally to partners. I recommend a birth class that gives them labor positions to help you into and things that they can be doing in the hospital to help you have a better birth. I'm going to link that class down below. Now, how can we tell that an induction is not working? Sometimes you just don't contract. We don't see any contractions on the monitor. You're not in pain at all. Your body is just fighting the medications. And so that can be a thing. But sometimes you are having pains and contractions, but your cervix just is not opening. It is staying firm like concrete. So that can be a thing. Usually it does involve vaginal exams where we check to see if baby is descending or if it's opening up your cervix. So that's usually how we can tell. And again, if you're listening to social media where they say you don't need any vaginal exams, that is definitely not true for an induction. It is our best way to know which medications are working and how to get baby to be delivered. Okay, so if your induction isn't working, there are 3 paths that we can really take. And there are some things that we think about before we choose which way. And the number one reason is, why are you being induced? Do you have a very severe form of preeclampsia that could really be a problem for you or baby? That is not something that we want to send home. It really is a lot about the reason why you're being induced. And I'm here to tell you that there is a lot of gray area in labor and delivery. There is a big difference between severe preeclampsia and just some mild high blood pressures, which come and go. And you and your provider need to be having that conversation about how hard you're going to try in this induction before maybe we end it, in one of these different ways. The next one is, what have we tried? There's a few different medications that we can try with an induction. If we've tried all of them, then we're kind of stuck in a hard place. Your body just isn't responding to any of them. But if we haven't tried them all, we can try something different sometimes. And also your preferences. Do you want to try harder? I got to say that a lot of people come in for their induction and they just plan on having that baby in the hospital. And the fact that we might send you home is just too much for them. So that again angles for your preferences. So what would we do? Number one is we could end up sending you home. I think when you go in for an induction, especially when you're in the gray area or just choosing to be induced, you need to be aware with the fact that it might not work. And your best option might be to go home for a few days, let your cervix percolate a little bit, and maybe you can come back in a little bit and try again, or you might actually go into the actual regular old-fashioned labor and have your baby that way. I know that this is an emotional thing that people think I'm going to come back with a baby, but going home and maybe waiting a couple days could be a good thing as well. The next one is to have a C-section. Sometimes if labor is just not progressing, the patient's tired, the doctor may offer a cesarean section and the patient may think, yes, I 100% want that. I want to be done with this. Just get this baby out of me. Now, some patients are also going to be like, no, I do not want to try a C-section. What else can we try? Editor Hillary here. I feel like I just like ended that thought. The reason I'm saying that is both ways are valid. It's valid to say, no, I'm just done. I just want a C-section. A lot of people just prefer that. And it's also valid to say, no, I really want to press onward, making sure that you're gathering the information about what's safe and what's best for you and baby. But both things are valid, and it's really important to choose what works best for you and what feels best for you. Can I say best for you again? And the third thing we can do is try different medications, different techniques. There are a few different ways to induce you, and there's also mechanical methods like breaking your water. We can try breaking your water, but if we do break your water, that means you're staying in the hospital. We can also try what's called a Foley bulb, where we kind of put a little balloon inside your cervix and mechanically open it up in a different way. So yes, you might have a C-section, you might go home, or we might try different methods. Those are the things that can happen if your induction is not working. But the most important thing is getting prepared for that induction. So many people are not prepared for induction. And I got to say, it's shocking how few birth classes actually talk about induction, considering the percentage of patients who are being induced. So when you choose your birth class, make sure that you choose one that includes induction. I'm going to link the birth class that I recommend that does talk about induction and what to do in early labor. I'm going to link that one down below. Now, a lot of this really revolves on how ready your body is to be induced. The failure of being induced usually happens when you're not as ready to be induced. So I actually have a whole video that talks about if your body is ready to be induced. I'm going to link it up above. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared for your upcoming hospital birth and possible induction.